Welcome to OET Answers.
Your preparation time is over. You can now start your roleplay.
Don't worry if I stop you when the time is up.
Hello, good morning Patricia. Good to see you again. I am Nurse Andrew, your attending nurse here today. How are you doing?
Good morning, nurse. I am doing great. Thank you for asking.
Good to hear that. Well, I am here to remove your stitches. Afterwards I will clean your wound and redress it.
Alright, nurse.
Before we start, may I know, do you have any concerns, please?
Yes, nurse.
During the consultation, the doctor told me that I have something called squamous cell carcinoma, which I think is just another name for skin cancer. So I am really worried.
Your concern is understandable. For your better understanding, I will explain it to you.
Okay. That will be of great help, nurse.
Patricia, squamous cell carcinoma of the skin refers to a type of cancer that forms in the squamous cells which make up the middle and outer layers of the skin.
Oh, I see.
Even though there are many treatment options available for squamous cell carcinoma, the best method is surgery. Now Patricia, you can be left off your worries as you have already undergone the surgery. I can assure you that the surgery helped to remove the lesion, and thus your cancer is unlikely to spread.
Okay, that is something good to hear.
However, what you have to keep in mind is that you have to pay attention and monitor your skin regularly. It is important to check for new or changing spots in your skin. A regular GP's checkup is highly recommended. I hope my explanation is clear to you.
Yes, it is. I will follow your instructions.
I now have a better understanding of what squamous cell carcinoma is. But nurse, I wonder, am I likely to need more surgeries to remove other lesions in the future?
Your question is appreciable. Perhaps it is beyond my scope of practice, so I am not the authorized person for providing such information. Your GP, who has in-depth knowledge about your condition, is the best person to answer this. Kindly clarify your concern with him.
It's all right, no problem.
By the way, Patricia, I would like to know your habits when in the sun.
Nurse, these days I always wear factor 30 sunscreen or higher.
And I also wear a hat when out in the sun.
However, I think it's too late because the damage has already been done.
Your current practice is absolutely necessary. Also, what you have said is a fact, and they too agree that some damage is historical. Nonetheless, I advise you to continue covering up in the sun as it is essential to prevent further damage.
Of course, nurse, I will surely follow it.
I appreciate your understanding and willingness, Patricia. Well, how about your wound post-surgery?
I'm alright, nurse. I haven't been experiencing any complications so far.
Good to hear from you. Patricia, for confirmation, do you find any discharge from the wound?
No, nothing.
Alright, so you are ready for the stitch removal, isn't it?
Nurse, I am a bit confused. Isn't it too early to remove the stitches?
Your thoughts are considerable. I will explain to you the reasons for the removal of stitches now.
Okay, you may please, nurse.
Typically, the stitches are removed after 7 to 14 days since the doctor has assessed your wound, and no other complications have been figured out. Moreover, the doctor suggested the removal of stitches. This indicates diagnosis done by the doctor will be the favorable way for your wound to heal.
Yes, I got it.
That's perfect. Patricia, you have to follow some wound care management after the stitch removal. I will brief you on that. It is very important to keep your stitch wound clean when going out. Keep it covered and dry. This will help to heal the wound faster and with no chance of getting infected.
I understand that.
Patricia, do I need to address any more queries?
No, nurse, I am good.
Alright. Can I have your consent to have the stitches removed, please?
Sure, nurse, you can remove the stitches.
Thank you for your consent, Patricia.
That is the end of your old speaking roleplay.
All the very best.
Thank you.
Thank you for watching. Kindly comment your suggestions and help us do better.